Hello, I'm Dr. Patricia Katowa-Mukwato, Senior Lecturer at the University of Zambia School of Nursing Sciences, where I teach in the Department of Basic and Clinical Nursing Sciences. I teach fundamentals of nursing, I teach medical surgical nursing, and I teach health assessment and diagnostic reasoning to the Masters of Science in Nursing candidates. So part 2 of this presentation is going to focus on the medical and the nursing management. Remember your pathophysiology and relate the drugs to pathophysiology. So the first drug that we are going to administer here, or that is commonly prescribed in individuals with hypertension, they are vasodilators. And the common vasodilators that we have in our setting, there is hydralazine, and we have also nitroglycerin. Now hydralazine is one of the powerful vasodilators. Is actually used in situations where the patient has severe elevation in blood pressure or in severe hypertension, and you can administer hydralazine either orally, but in cases of severe elevation in blood pressure you have to give it intravenously. So intravenously is actually a routine practice that you give hydralazine 5 milligrams IV start, and you can repeat that if an individual has a diastolic blood pressure of 110 millimeters of mercury. So hydralazine can be given as an intravenous drug. You can also give it as an oral administered drug. But for all drugs, they have side effects. So the side effects of hydralazine include headache, nausea, tachycardia. There will also be dizziness, and then in certain individuals actually it can result in hemolytic anemia. Now I mentioned about nitroglycerin. It's another vasodilator. Nitroglycerin is a drug that is administered. There are very few drugs that are administered through the sublingual route, but this is one of them. Is because under the tongue there are a lot of blood vessels, and this drug will quickly dissolve, and then it will have its effect on causing vasodilatation. So in individuals that have a high blood pressure, severe raised blood pressure, nitroglycerin is prescribed. Is put under the tongue, it dissolves, and within 30 minutes it will have its effect in reducing blood pressure. And some of the side effects, as I said, it has quick effects, so it will result in a reduction in blood pressure within a short period of time. So the patient may just go into hypotension and they may have a headache. Another category of drugs that are commonly prescribed are what are known as the beta adrenergic blockers, or people just refer them to as beta blockers. And common examples here which we have in our setting, we have atenolol, we have propranolol, we have carvedilol, and all these drugs, they counteract vasoconstriction. It means that they are going to cause vasodilatation. Let's take an example of propranolol, which is commonly prescribed here. It can be administered as 10 milligrams once or twice a day, and this is usually through the oral route, and it will have its effect. And then I gave an example of carvedilol, which is a third generation a kind of beta blocker. And this type of drug, its presentation is about 6.25 milligrams, and you can administer it. It's also administered via the oral route. It is usually prescribed once a day, but in severe cases it can be prescribed twice a day. So for these drugs like propranolol, it may actually cause heart palpitations and dizziness and tachycardia, but carvedilol has mild side effects. The next type of drug that is prescribed, which you can combine, actually let me mention that these drugs are not prescribed as single drugs. Usually you give at least a combination of two. So the next one is what is known as angiotensin converting enzyme inhibitor, and an example of that is captopril. It's also common in our setting. You can find it in the presentation of 50 and 25 milligrams. It can be given once a day, or it can be given twice, or BD, or what is known as TDS, or 3 times a day. For this one, it inhibits the conversion of angiotensin 1 to angiotensin 2, And we said that when there's that conversion of angiotensin 1 to angiotensin 2, then there will be production of aldosterone, and then there will be sodium retention. So once you inhibit this pathway, it means that eventually there will be no sodium retention. The side effects again, hypotension. Some people have reported skin rashes. Others have reported also, or you find that the patient has hypokalemia, that is a reduction in sodium, because of that effect of reducing the production of a retention of sodium. The other drugs are what are known as calcium channel blockers, and we have common examples in our setting is amlodipine and nifedipine. So these ones, they block the effect of the movement of extracellular calcium into the cells. When that happens, it means it results into vasodilatation, because calcium causes vasoconstriction. So nifedipine presents as in 10 milligrams, also in 20 milligrams. The side effects include nausea, vomiting, sometimes constipation, and also tachycardia. Apart from those drugs, also if the patient has edema, they have fluid retention, we can also prescribe loop diuretics. For example, furosemide. Furosemide inhibits the reabsorption of sodium, and if you remember in our pathophysiology, we mentioned that the absorption of sodium causes fluid retention, and when there's fluid retention, there's an increase in blood pressure. So furosemide can be given either as IV to reduce the blood pressure almost instantly, or it can be given as an oral drug, either once per day or twice per day. So this drug, because it has an effect it reduces the reabsorption of sodium. So I think you may suspect a side effect. The side effect actually may be electrolyte imbalance. The other type of medication that you can prescribe are what are known as potassium sparing diuretics. From the name, you can tell that they spare potassium. So a common example in our setting is aldosterone. It inhibits sodium retention and also potassium excretion. So that's why it's potassium sparing. And you can give it orally 25 milligrams. Sometimes it goes up to 100 milligrams. The side effects, it has a strange side effect here. This one has what we call gynecomastia. And gynecomastia is a condition where the breast starts growing in a male. So that's one of the side effects of aldosterone. And it may also cause impotence or decreased libido. Most of the individuals who are hypertensive, if they are prescribed with certain antihypertensive drugs like we have mentioned aldosterone, they will report reduced libido. And I mentioned also gynecomastia. For women, they may have menstrual irregularities. So now we have talked about the medical treatments. Let's talk about also the nursing care. The nursing care that you provide for each and every patient, I'm sure you know that to nurse a patient, you need to meet all the activities of living, starting from breathing, elimination, if at all they is severely ill, mobilization, rest and sleep, and so on. So for this one today, specifically for hypertension, I'll just give you the specifics. And the specifics will start with observations. These patients who are hypertensive, observations very important. Observe the temperature, the pulse, the respiration, most importantly the blood pressure, because that's an indicator whether your treatment is effective or not. Then you also need to weigh the patient. Remember we talked about the effect of sodium and sodium retention and how it results in elevation in blood pressure. And the patient may just have a sudden increase, especially those who are progressing in heart failure. You need to weigh the patient daily or on alternate days. You need also to observe if the patient's levels of fatigue. You need to observe if the patient is able to carry out their own activities of living. You need to observe also if at all they are still edematous and such. All those are specific observations that we make on a patient who's hypertensive. The other one is rest. It is important to ensure that a hypertensive patient has adequate rest. And for rest, it's mandatory, and the patient should rest in a calm environment. by all means ensure that the environment is less stressful, so that you reduce the effect of stress, and eventually the patient will be able to have a reduction in blood pressure. So ensure that the patient has adequate rest. Physical activities, they may do moderate physical activities, but in situations where the patient has a very high blood pressure, initially it should be total bed rest. No activities at all, meaning that you are going to carry out all the activities of living for this patient. But after that, the patient can start getting involved in their own care, meeting their own hygienic needs like brushing the teeth, bathing, and so on. Later on, then they can start some physical activities like exercising. The diet that you should give this patient, we talked about the effect of sodium, so definitely a low salt diet. Low salt diet, ensure you tell them why you are restricting sodium. For patients who are overweight, you reduce the caloric intake, and also ensure that the patient does not consume foods that are high in cholesterol. Foods high in cholesterol include red meat, so restrict that, but this would depend on whether the patient has hyperlipidemia. Remember the investigation that we did. Drug compliance, very important, because when you start a patient on antihypertensive drugs, they are supposed to take those drugs for life to keep the blood pressure within the normal range. Most of the patients will end up having a stroke because once they feel like now they are well, they are able to do all the activities, there's reduced fatigue, there's reduced palpitations, they are going to stop the drugs because they won't feel any pain. But remember, in layman's language, they say hypertension is a silent killer. Why is it a silent killer? Because usually there will be no signs and symptoms. So when the patient feels well, they may try to actually stop taking the medication. Emphasize at the point of diagnosis that taking medication is for life. Why is it for life? To maintain the blood pressure in the normal range. And when you maintain blood pressure in the normal ranges, it means that a patient may not have other risks of hypertension, like other complications like cardiovascular, cerebral vascular accidents, and also others like congestive heart failure. So in this part 2 of the management of a patient with hypertension, we have described the medical management, the drugs that we give, starting from vasodilators. We talked about diuretics that you give. We talked about beta blockers. All those drugs can be given in combination, and they have different effects, and different patients will respond differently to those drugs. Look out to the side effects, and side effects actually may make a patient stop taking the drugs. So if the side effects are not manageable and another drug can be prescribed, advocate with the doctors that another drug should be prescribed so that the patient can continue being compliant. So hope you'll be able to use this information first and foremost as nurses, and also in the community, to sensitize the community, and also everywhere else you find yourself, because now we are focusing on primary prevention so that we prevent development of hypertension, so that we don't have the secondary effects of hypertension. Thank you so much.